Being unique is better than being perfect. But what if you have the blend of both uniqueness and perfection? And then you derive the tagline, experience the art of healing. And I am in conversation with the CEO of Burjeel Hospital, Abu Dhabi, Mr. Clancey Pro. Hello and welcome to the show.
Good morning.
Well, tell us something about yourself.
I have over 25 years of experience in the Middle East, India, and Canada. Primarily, most of my experience has been in the Middle East. I have worked in countries like Oman, Doha, Qatar, UAE, both in Dubai and in Abu Dhabi. And I've got this rich experience in the private healthcare market. My educational qualifications, I've got a master's degree in administration from an Australian university. And as far as I'm concerned, I consider myself as a Burjeel man. And Burjeel is all the experience that I can talk about. We started about 2.5 years ago in Burjeel. And today, Burjeel stands as the #1 private hospital in Abu Dhabi. And indeed, it's going to become a name to reckon with in the near future.
Is it the largest private hospital in Abu Dhabi?
Burjeel is, remember, hospitals are calculated based on the number of beds. We currently have 251 beds, and that makes us the largest private hospital. But we don't pride ourselves on being the largest. It is what our patients, and we don't even call them patients, we call them guests, what they tell us about us that makes us different.
Now, give us a falcon's eye view on Burjeel Hospital, Abu Dhabi as a whole.
Yeah. Burjeel Hospital started in April 2012, 2 years ago. And I must say that, when we started, everybody did talk about it being a white elephant. Today we are full to capacity. In fact, our ICU is full, our inpatient is full. We practically see 45,000 outpatients a month. This, by far, I have worked in different hospitals in different parts of the Middle East, and I must say, I have never seen results like this. It is just that we worked in a very different strategic manner, where we took the art of healing to a different level. And perhaps that's the reason why today Burjeel Hospital is seen as an iconic brand in healthcare.
Tell us something about the different portfolios of Burjeel Hospital, Abu Dhabi.
Burjeel Hospital is a tertiary care hospital, and it was started with the vision of providing end-to-end care. So we have right from family medicine, right up to cardiac surgery. We have all the modalities that one requires in a tertiary care hospital. I can only say that what we don't have is cancer treatment, and that's something that we are going to go into the future. We have about 27 specialities, and we even have other subspecialties that exist in this hospital. Today, we take care of practically, as I said, 45,000 outpatients and thousands of inpatients on a daily basis. What we would like to do is, we are now going to the next step, where we are building Burjeel as a healthcare family. And our aim is to promote what we call as the hub and spoke model. We are building more community centers all around Abu Dhabi. And I can speak for Burjeel because we are part of the VPS Healthcare Group, which is growing at a very exponential rate. Our aim is to look after Burjeel and make it the landmark premium healthcare destination for all the residents in Abu Dhabi.
It's like a one-stop shop for...
One-stop shop, and it's also one-stop shop at the hospital. And yet now what we're doing is we're also going to different communities. As an example, just last week, we started a hospital in Bahia region, which is very close to Shahama. It's about 35 kilometers away from here. A very state-of-the-art, 17,000 square feet of space, one medical center with about 14 specialties, MRI. This is our approach to medicine, where we, rather than the patients coming from the Bahia region to us, we are going out and reaching out to them. We will have a community service, and just in case if they require secondary level of care, they do come to us.
Tell us something about your people, your equipment and so on, your infrastructure and so on. You've already touched it, but we'd like to have a broad insight.
Equipment is only one small component, given the fact that we are a human resources related environment or industry. From our point of view, we will go and buy the best of equipment, because to me, if it means lesser radiation to my patients, I'll rather pay $1 million more just to ensure that my patients are safe and secure. We have invested in the best. As an example, we have the hybrid OR, the only private sector hybrid OR in town. So today, my vascular surgeon can do the best of surgeries in a hybrid OR. My MRIs, we have two MRIs, one of which is a 3 Tesla MRI. It's faster, it gives better images. We have the best in all the areas, including our ICU. We are even bringing in newer technology that does not exist in Abu Dhabi.
Okay.
And that's our aim. Our aim is that whatever exists as far as the latest technology is concerned in the world, we will bring it to Abu Dhabi.
We'd like to know more about your doctors and non-doctors.
Our doctors, Abu Dhabi primarily, the health authority over here is very stringent when it comes to its rules of licensure. And they would like very good doctors to come into Abu Dhabi. And I think that's something that we like about the health authority. It is very easy for us to bring in good doctors who are primarily Western trained. So most of our doctors, being a hospital, we normally require doctors who are consultants and not GPs and specialists. So most of our doctors end up being consultants. And the health authority rules over here require that people have Western experience. Most of our doctors have been headhunted from Europe, from America, and especially people who probably were Easterners and who went to Europe and America and wanted to return to a land which was closer to their home place. And that's been our strategy. But from the nursing point of view, we all know that the breeding ground for nurses is India and the Philippines. So quite often we go to the Philippines and India and pick up the best nurses that they have and bring them back to this country.
Well, the healthcare industry is a very particular industry. It's a specialized industry, and you're dealing with human beings. You're not dealing with products, and so the so-called trust is there. Now, how did you develop such a big trust among patients or human relations, to be in particular, in such a short span of time?
We are a private hospital, and many of them claim that we are a for-profit hospital, but it ends there. For us, we believe that profit is a byproduct of the service that we give our people, whether it is our staff or whether it is our patients, whom again we refer to as guests. The reason why people have started believing in us is we have spared nothing to ensure that the satisfaction of our guests is ultimate. So from our point of view, we do not really care about how much does it cost for, say for instance, I was just now in the ICU looking after a small child who actually has something that the parents are all concerned about, and it does not matter that I have to send this child to the United States to one of the best children's hospitals if I have to, and it doesn't matter what it costs me, because for me, their satisfaction is more important than. And I think it is this approach to medicine, and it is this approach that the chairman of this hospital or the managing director of this hospital, Dr. Shamsher, has, that we have been successful. We believe that commercial success is a byproduct of the service. And that's the reason why we do not look at how much is it in for us, but how much can we give. And I think this giving has helped us a lot. I would encourage all other private hospitals to follow in the same manner, and therefore you will eventually all be successful. Because if people tend to start disbelieving their doctors, I think that's the beginning of the end.
And in short, you would say, or we would say together, that it's all about patient delight, is it not?
Absolutely. We are not only into the habit of delighting our customers. As an example, today is the beginning of the holy month of Ramadan, and I am actually inviting all my guests to come in and share into a family iftar that we have organized in our hospital. We believe in delighting our guests by having even a pianist during non-Ramadan days, where we can play music, and this is soothing music, because we believe music also helps in recuperation of patients. We even have a children's corner in which you can actually children come and play their games. My son, for an example, loves to come to this hospital. We have practically changed the entire scenario of the way healthcare is delivered, simply because when I was a young boy, my parents used to warn me that if at all you misbehave, I'll take you to the hospital. And I was always worried about being given an injection. Today, we have changed that 360 degrees, and we have now come up with a concept where the parents actually tell the children that if you behave well, I'll take you to Burjeel Hospital.
It's the other way around.
It's the other way around, because now they can actually come in. There's a nice valet parking. There are people who our guest services executives who actually invite you in. There's a coffee man who will provide you coffee. There are machines that serve you juices. There's a hot chocolate for children. There's this pianist, and then you have the play area, and then we have 5-star restaurants, and we have changed the entire ambience. And quite often people tell me, "Oh, you're very hotelish," and we say, "Why not?" Because our two pillars of that we depend on, one is clinical excellence, and the other one being the art of care, is where we believe that patient satisfaction comes from, and one cannot live without the other. So we have been able to take this forward, just like you said, delighting the customer. Valet parking at one point of time used to delight customers, not anymore. So perhaps the next time when you come in, I may even wash your car and give it to you, because we believe that delighting customers over a period of time becomes basic, and we have to think of innovative ways of trying to impress our guests.
Experience the art of healing. How do you substantiate the statement? And you're the right man to substantiate the statement, being a CEO of Burjeel Hospital.
The art of healing is something that we coined during the commissioning period of this hospital. We studied the market, and we realized that most hospitals had forgotten the holistic way of treating patients. My belief is that we are now doing something that even Western hospitals don't do. As an example, my family lives in Toronto, and I know that whenever I go to my hospital in Toronto, I'm quite often seen as a number, and quite often it is how quickly can this patient be discharged is all that they're thinking about, because either they are overwhelmed with patients, or they just want to they just think about it as a job. At Burjeel, we have identified people, and this is what I did right at the beginning. I identified my managers from different parts of the world, simply because I knew them personally, headhunted them and brought them in. Not necessarily because of the experience, but because of how passionate they are. I then asked them to choose a passionate set of people. All the people that we have had that we have employed in this organization are people who are passionate. And we believe that this is the success of any organization, because experience and education can only take you up to a particular limit. But if you don't have the fire in your belly, you won't be able to reach to the next level, which is what we wanted in Abu Dhabi. We also believed that there was a gap in the market, and this gap in the market was about providing a premium level of service. And we required people who did not think about time, were not clock gazers, who looked at, okay, how can I help this guest even more? And this art of healing concept did help us. Because what we did was, we then started teaching our nurses as an example, how to hold a hand of an elderly patient, how to take care of them, how to probably give, even the guest of the guest, that is a patient whose relatives comes in, how to treat them, how to give them, meals that they require. We even went to the doctors and we asked our doctors how to dress, the bedside manners, how do you speak, how do you smile. I even have instructed my HR department to probably look at the possibility of checking whether does a doctor smoke or does not smoke, because for us that's very, patients are very sensitive to the smell of smokers. And we look at all the tiny things that are very important from a patient point of view and not from our point of view. Because if you look at the experience of the best hospitals in the world, primarily the ones who look at, which are very profit oriented, they all look at patient numbers and how much is it that they can. We don't look at that. We look at the smile is our reward. The smile of a guest is the reward that all our staff look forward to.
Well, tell us something about your expansion plans, and where do you see the group, the hospital, 5 years from now?
We as Burjeel Hospital are part of the VPS Healthcare Group. I can only speak about Burjeel, but I can also tell you that the VPS Healthcare Group has 3 distinct brands. The LLH Hospitals Group, the Life Care Group, and of course the Burjeel. What our Managing Director, Dr. Shamsher, has done is he has allowed each and every unit to grow at the level that they would like to. So sky is the limit over here. I can tell you about Burjeel Hospital in Abu Dhabi, and as a group, what are our plans? We plan to invest over $1.5 billion, which is equivalent to 5.5 billion dirhams, in the healthcare market in Abu Dhabi. That includes 4 hospitals, 10 medical centers, and 5 specialty clinics all over Abu Dhabi. Again, the concept is the hub and spoke model, where we will go out to the different communities all over Abu Dhabi and provide this care. We then further expect to replicate this same model into other different countries. The first country that we are looking at is Qatar, and thereafter we plan to go to Saudi Arabia. You probably know that from a gap analysis point of view, when you compare ourselves to, say for instance, Western countries, there's a huge requirement for number of beds. And our aim is to fill up that gap, because we believe that once we have quality healthcare it's here to stay. And we are not going to look at a mediocre level of service. So $1.5 billion includes a hospital for cancer, the Burjeel Medical City Hospital in Mohammed bin Zayed City. We also plan a huge daycare center, which is probably going to be the largest daycare center in the Middle East, in Reem Island, which is very close to the hospital. We also plan to have a large hospital in Al Ain, which is you probably know, part of the Abu Dhabi Emirate. And we plan to have 1 hospital in the Western region. Now, this plan is not for 5 years, because we do not have a 5. For us, what matters more is just 3 years. We are an organization that's very dynamic, and therefore our objective is that as soon as we see that there is an opportunity, say for instance in Saudi Arabia, say for instance in Qatar, we will immediately get into action and ensure that this hospital, the plan starts working.
Well, you seem to be on the run. So how do you manage time between your professional and personal life?
That's a very tough ask. I must say that I am, although I look like a corporate man, I can actually switch pretty quickly. I am a person who loves his family. I am a person, I have 2 children, and I have a wife at home. I even have my parents who live with me.
Okay.
And I somehow am able to switch over pretty quickly. So when I go late in the evenings, I ensure that I spend enough time with my parents, with my wife, with my children. And the reason why I believe that I'm successful is because of them, because they have been able to adjust as I went along in my corporate life.
Well, to wind up the show, I would just like to ask you the sole question, which says, what is that one message that you would like to give on behalf of Burjeel Hospital?
The one message that I'd like to give to the people of Abu Dhabi, and indeed that in the UAE, is prevention is better than cure. Please, we want you to come in when you're fine, come in for your health checkups. We want you to come in when everything is okay, so that we can nip it in the bud. We can nip all the problems in the bud by ensuring that you have a regular checkup, and we hope that you never come here as a patient.
Thank you for your time.
Thank you.
And look forward to associate with you in the future.
Thank you.
Thank you very
Thank
much.
you.